Welcome back, everybody. We'll be trying to get on Skype South Sudanese doctor. He's a surgeon, Dr. Evan Atar Adaha. He is the 2018 recipient of the UNHCR's Nansen Refugee Award. We'll tell you a little bit more about this award once we get that link up and running. But I want to, in the meantime, talk to you a little bit about some of the, this is the work that Dr. Evans Adaha actually does in South Sudan. And it's quite fantastic, actually. This prestigious humanitarian award is presented every year to an individual or organization that has dedicated their time, their energy and resources to help people forcibly displaced from their homes. He's done 20 years of medical services to people that have been forced to flee conflict and persecution in Sudan and South Sudan as well. He is based in Bunj. This is in northeastern South Sudan, where he runs the only functional hospital. It serves 200,000 people. In fact, more than 200,000 people. This is incredible. It really is. So we're hoping that we do have the connection up now. So Dr. Evan Atar Adaha, a very good morning to you. Are you able to hear us?
Yeah, morning to you.
It is an absolute honor to speak to you, and thank you very much. Congratulations on the award that you have won. What does this mean to you to get something like this?
I'm really humbled to be actually having this award, and it means a lot for us. It's going to actually push us and make us really in a better situation to give services which the people really need.
Dr. Adaha, tell us a little bit more about the work that you do. We have basically told our viewers that you are working and serving in a hospital, the only functional hospital that helps in excess of 200,000 people.
Yes, that's true, that we have to work almost 24 hours, 48 hours because of the numbers, which are really so many, in such a way that they come almost all the time. And we have, from time to time, we have emergencies coming in from the different camps. We have about 4 camps in Bunj, which is Batel, Jenrasa, Kaya, and Doro. So there are some facilities there which actually refer cases to us, and we manage the cases which are a bit difficult from those camps. And it is a daily work that we have to do almost all. We do surgeries, we do deliver ladies, and we do C-sections. Name it, any general emergency that we are doing them, because there is nowhere they can go.
Yeah. What are the kind of procedures that you do? Obviously, the people that you see are in very desperate situations, whether it be injuries from war, from just basically being malnourished, children, women, men. There must be a host of things that you see. But what are you mostly treating?
In most cases, of course, we normally manage according to the importance. There are emergencies like C-sections, bowel obstructions. We do resection and anastomosis. We also do hernias, strangulated hernias. So we cover all the emergencies. Then now comes to the war injured. We also do the war injured the same way we are doing the rest. And sometimes we do thoracotomy to remove bullets, and also we have fractures. We have to also do parts of orthopedics in it. We have sometimes we have hydrocephalus. We have to put the shunt. So many and a number of things that we are doing. A person who is really specialized in one thing will not be able to do the job, but we have to take at least from each specialization to help the patients. And we have also malnutrition, that is severely acute malnutrition. So we stabilize the cases and send them back to the feeding centers. We have TB wards, we have Kala-Azar, almost all the diseases that we have in the area. We are trying hard to make sure we give them the treatment.
Yeah. What I've been told is that you oversee an average of 58 operations per week in these very difficult conditions. You have limited equipment, limited medication. I can only imagine the other difficulties that you go through. What are the kinds of things that you deal with when it comes to a lack of resources under the conditions you work in?
Yeah, we have, in these 20 years, we have learned on how to improvise most of the things. We went to the extent of using the grass straws to use as chest tubes during that time, but not now really. Sometimes back, we were able to do anything. And today we can use the sutures which are not having needles. We can use the normal needle that we are using for injection. So they are good. We can improvise. We can fix the sutures in it, and it gives us a better, sharp needles.
Yeah.
So this is just an example, but so many things we have to improvise and make sure we are able to do the job.
Yeah, I mean, I'm reading the kind of, again, I go into the conditions. I mean, this is a civil war that's in South Sudan. It's going on now for 5 years. It's creating one of the worst refugee problems. You work in a hospital that services all these people. You have one X-ray machine that doesn't work. You work under one single light that you have there for a 24-hour period that you talk of. And I could continue to talk about some of the conditions that you work under. And yet, you and your staff, you still come through, you still do this, you're still motivated to carry on. Do you hope that by winning this particular award, you will be able to get more resources and let the world realize what you're doing?
This is all my hope, because now you have already mentioned a number of things, like we need actually oxygen generators, like 4 oxygen generators. We need the X-ray machine. We need the anesthetic machine. These are things that the basics that we would like actually to have will allow us to do quality services to the patient and continue to help the people as the situation is actually required.
Yeah. I thank you so very much for talking to us. We congratulate you and we commend you for the work that you do. One of our selfless heroes that we're talking to. This is the winner of this year's Nansen Refugee Award, Dr. Evan Atar Adaha, running a hospital that services over 200,000 people, and yet they have no resources but continue to work helping the refugees of South Sudan.